Welcome to You Make the Difference. I'm Wanda Walker, and today I have as my guest Judge Key. Judge Key is with the Troup County Juvenile Court System, and we're so glad to have you. You have a new initiative that you have introduced to the community, done a town hall meeting. Tell me about that, with trauma-focused communities. Tell me about that.
Well, it's a journey for us. We don't know where we're going with it. Like one of my friends told me one time, systems improvement is a journey, not a destination, and we've just started the journey, so we haven't gone very far along the way. The issues around trauma, and for the last couple of years as I've gone to conferences and meetings around the state and around the country, people have talked about trauma, and they've talked about trauma-informed systems, and they started talking about trauma-informed courts. And so last fall, I decided it was something I thought we should be involved in. I don't know a whole lot about it. I'm just a country judge and lawyer, but it was obvious that some of the children and families that we serve were involved with trauma and had suffered events in their life that affected the way they behave in school, in their lives, in the communities, and even in court. And it was obvious to me that we should learn how to deal with those families. One of the first things that really informed me around that issue was a book called Helping Traumatized Children Learn. Even though it's built around education, it really helped me understand how I should try to deal with children and families who have suffered from trauma and have been impacted by trauma, and how my staff should as well, and everyone else involved in our system. So I began talking about that book to a lot of different people, and then as I became introduced to trauma-informed systems and trauma-informed court, I wanted to know what that really was, and if I really wanted to be one. So I sent an email out to the Barton Clinic, Melissa Carter at the Barton Clinic at Emory University, and to Dr. Sean Marsh at the National Council of Juvenile Family Court Judges, and ask them, and to others, Michelle Barkley at the Committee on Justice for Children at the Supreme Court. And so what is a trauma-informed court? It sounds like something we want to be in Troup County. And as I learned more about it, then there really is no such thing now clearly defined as a trauma-informed court. It's an evolving concept for a court itself. Obviously, the National Child Traumatic Stress Network, I think is what it's called, has been doing a lot of work around trauma-informed systems, but not so much a focus just on the courts. So when I asked that question, it set a chain of events in place that we're still kind of riding out that chain, it looks like. One of the things that we did this year was what we call Trauma Week. And Trauma Week consisted of a team from the National Council of Juvenile Family Court Judges coming in, a team of 4, spent the week with us.
Yes.
They observed court, they interviewed stakeholders, they talked to some of the kids, and then we held a town hall meeting on Thursday of that week. We had close to 200 people show up for that meeting, and I thought it was a phenomenal meeting. It
was.
I was worried about it. You were there.
I was.
What was your take on it?
Yes, I loved it. And, you know, it was very encouraging to look around the room and see who was there, the different agency heads, and, you know, that they were interested in it, and then the presentations were very interesting too. Kelly Ville made a presentation about trauma reprocessing, and that was very good, and there was just a lot of energy in the room and a lot of interest, and so I thought it went very well.
I did too. One regret that I have about it is that we did not do a good job of getting the word out to the general public. And I feel bad about that in a way, but in a way I don't, because we're still learning it ourselves.
Yes.
And it's the kind of situation, and you know this because you're working on one of the committees, is we're a little bit nervous about making the community at large aware of this issue in detail until we have things in place to meet their needs.
Right.
We certainly don't want to stir people up and they identify themselves or a child of theirs as someone who might be in need of these kinds of services, and we don't have the services in place. And we have, when we put the word out like we're doing today, and then people call you or call me and say, we want you to come to a program at our civic group or whatever it is, and we don't have those kinds of things in place. So very rarely when we start an initiative do we have to deliberately slow things down, but that's what we've had to do here.
Yes.
After Trauma Week, or even as we came into Trauma Week. Then on Friday of Trauma Week, we had a stakeholder group meet together, and we were told by the facilitators that we need to have 20 to 25 people there, and we kept thinking about people that we needed there, so we had people sitting against the walls, and we went up with about 40 40 very, very interested people there, and we began to do some action planning. Now, trauma itself, I'm not an expert on that, okay? But I do know, particularly from reading the book, Helping Traumatized Children Learn, is that everyone in their life, unless they're extremely lucky, suffers some
Yes.
traumatic event.
Right.
Whether it's the death of someone that you're particularly close to, whether it's observing a shooting, a car accident, anything like that. There are a number of traumatic events that you can have, and people kind of can guess those. Everybody could probably make a list of what they consider to be traumatic events. What we overlook a lot of times, though, is the chronic events in somebody's life that really cause the same sort of effect on people, and sometimes even more so than a single traumatic event. And one of those things happens to be neglect or abuse over time.
Yes.
What research is showing us now, as I understand it, is that abuse and neglect, even neglect over a period of time, can have the same impact on a child as witnessing several traumatic events or being the victim of traumatic events. And it impacts their life in so many ways. And with our children in school, the book, Helping Traumatized Children Learn, which you can Google, by the way, and get it, is built around the issue of trauma from domestic violence, although the authors of the book note that it's not limited to that. If a child is suffering from complex trauma, then they have the same issues to deal with as a child, however they got to that point.
Yes.
It doesn't have to be domestic violence. But we know from these children, and I'm talking about children, but children who have these issues grow up to be adults who have these issues as well.
That's right.
So,
I mean, in the audience, I know the audience was full of adults who were identifying with that trauma teaching. And after the meeting, there were adults wanting to know how they could get treatment for trauma.
Right.
So, I mean, it does. I mean, if you don't get treatment, and one of the things that is encouraging to me is that in Kelly's presentation, she said that you can come 12 to 18 times have those sessions with a counselor and heal that trauma. And so, lots of times we go into adulthood bearing that trauma for the rest of our life when we don't get treatment. And so it's nice to have a community that's focused on trauma and getting people treated for trauma.
It is, and when it goes in adulthood, then the problem is it's so easy to pass on, and I'm not saying it's genetic, it's not what I'm saying at all.
Right.
But one of the characteristics of someone who is suffering from trauma, complex trauma in a way that affects the way they do business, is that they're very easily agitated. They get angry very quickly, agitated very quickly, and very slow to get down from that. So as you carry that into adulthood and now you have children, then you respond to those children in the same way.
Yes.
And people who are suffering from complex trauma are hypervigilant. They're constantly thinking about, they're nervous about things, they're anxious about things, and so they're easily alarmed or alerted. And you can imagine the impact that has on a child. And so living in that kind of environment from one or more adults in your home can have an impact on the children as well. So, and it's the same in the schools. And again, we know from the schools, as noted in that book, is that a lot of our children in school who appear to be just have anger issues, as an example, easily
Yes.
agitated, then they have to be approached in a certain way. And in a way that's different than you have to approach other children. And if we don't do that, then they become labeled as those chronic troublemakers.
Yes.
And then the next thing you know, their education is behind. The next thing you know, they're dropping out or they're not getting the education they need. And that's through no fault of the school system. This is an evolving science, if you will.
Yes, and also being exposed to that trauma affects their learning abilities.
It does.
And so there are so many ramifications of being exposed to trauma that I am glad that we're exploring and looking at and doing something about. Yeah. In your court, what are the typical trauma exposure that you see for young people that come through your court? What are some of the most common causes of the trauma?
Well, again, and we're still, this is evolving in our court
Yes.
as well. We're just now starting to get trauma assessments to even identify those kids who really have suffered from complex trauma at the level that it impacts the way
To
they
be
do business and
sensitive to
function.
that trauma, yes.
But obviously, we deal with children who are victims of chronic neglect. We deal with children who are victims of physical abuse and significant emotional abuse over time. We serve children and families who live in areas where they fairly frequently witness violence in the streets.
Yes.
And not just domestic violence in the home, but violence in the street, but certainly domestic violence in the home. When we consider the domestic violence that we know about and those numbers, and that's really just the tip of the iceberg, we can imagine what these children are witnessing themselves. We deal with a lot of children, some of our more difficult children, as we get the psychological evaluations. We find that children that we never identified to have been the victims of sexual abuse have been the victims of sexual abuse as children. We had a young man whose parental rights we terminated, and he was a difficult child and difficult to place child, difficult to adopt child. And after he and his family had been served in the juvenile court for some time, and after we terminated parental rights, he revealed for the first time ever, when he was, I think, about 12, 13, revealed for the first time ever that he had been sexually abused as a child.
Yes.
A whole new range of issues come with that we never knew about to deal with them. But certainly sexual abuse is one of those things that, for children and adults, that can set this in motion.
Yeah, and I really like that Twin Cedars is doing an emphasis on sexual abuse of children. Right now, at the same time, the trauma awareness is coming to the forefront. So I think we're really on to something. And I'd just like to put in a plug for getting that sexual abuse training that's offered through Twin Cedars. If you haven't done that, contact them. They are really wanting businesses and schools and churches to invite them in to give that training so that we can be a community that can notice what the symptoms are and get children into the treatment that they need. So it's kind of interesting that both of these initiatives have started at the same time, and I think they'll go hand in hand with one another and will really make an impact in the community as these go forward. Now, with being a trauma-focused community, tell me what that means for the different agencies in our community. How will they work together to help alleviate this problem?
Well, let me say one thing about that, and then I'll go in a little bit more detail about it, is that we don't know when someone walks in our office or in our court for whatever service we're providing, whether that child in fact has these issues, whether that child's been traumatized and at what level, and how it's impacting that child's life. We know they're there for some reason, but we don't really know why. And that's why we've been advised by the people who do this business to take what's referred to as the universal precautions approach. And as I understand it, the universal precautions approach first came into vogue when, with AIDS. And some of us are old enough to remember when you went in to get your teeth cleaned and they didn't wear a mask and gloves.
That's right.
Just as an example. And everybody's not so careful about that. But the notion was that we have a significant issue here, a significant risk, and we need to treat everyone as if they're a risk. And that's, number one, is all of us want to get to the position where we have in place a system that serves a child and a family in a way that we are sensitive to trauma, and we serve every family in that same way. And if we do that, then we're certainly serving and not further traumatizing the children and adults who are suffering from trauma.
Yes.
So all of us want to get to that place. We, as the service providers and the systems, have to get our training first. Coming out of the roundtable, we put together 3 work groups that day. We now have 4 work groups involved. We have public awareness for the general public, and again, we're slowing down on that because we got to get other things in place first. We have the agency education and training.
Yes.
And there are other things that have to be in place even before that, and one group that's working on that, that's just getting started, is a service provider group. And then the 4th group we have is the measurement group. We do have a grant that we're working with. Troup County directly gets very little money from that, but the Barton Center at the Emory University School of Law gets a good bit of money to help us with this work. But we've got to measure to see if what we're doing is making a difference, a positive difference. And that's the 4th group. Our service providers are going to help us know how to deal with people when they walk into our office. What are we looking for? At what point should we do a general screening instrument for trauma?
Yes.
And then based on what that shows, then do an assessment for trauma. It's not going to be everybody, but it's going to be some people. And then when we identify those people in need of services, what services do we offer? And we are blessed to live in such a marvelous community. I mean, who would have thought that in LaGrange, Georgia, when this notion of trauma-informed court, and in the large sense, came up and we started bringing people together, that we had so many resources and so many people that, as always, that want to come out and help. And that's what we have, including our service provider group that's starting to do some, what I know is going to be phenomenal work. But we have to be able to identify the people where they're coming to a service provider, the school system, anywhere in the community, any provider in the community of services to these families, to identify the folks, do the assessments, the screenings, the assessments, and then provide services.
Yes.
Once we have that in place, then we can really get out into the public awareness piece.
Yes, and we're going to do evidence-based treatment.
We are, and again, we're just now talking about trauma as a significant issue.
Yes.
I'm not saying we've never talked about it before, but we're acknowledging its big role in the work that we do in our community for the first time. And already, the way things come together, we have Kelly Veal.
That's right.
Kelly Veal, who's not far away from getting her doctorate at Auburn. And Kelly is already certified in eye movement, I forget, desensitization and
reprocessing.
Something like that.
Yes.
She's already certified in that, which is a research-based tool that makes a big difference. As you know, it started with our military, with our soldiers who were suffering PTSD.
I didn't know that.
That's where that research started.
Wow.
Yes. And then we also have trauma-based cognitive behavioral therapy. And we didn't know, but we have therapists in Troup County that are trained in that as well. Many of them in the cognitive behavioral therapy, and some with the trauma-based focus on that, but easily getting to that level for a lot of our providers. And they're stepping up and going to be providing services. So we have services here that we were not utilizing because, again, there was no focus on this issue.
Yes. Now, you have always been a visionary and always wanted to get the community involved in different things.
Yeah.
And a couple of years ago, you did an education summit at LaGrange College. Tell us about that and what brought that about and what you wanted to accomplish with that.
Yeah, let me say first, I don't know that I'm so much of a visionary as
I think you are.
The kind of guy that steals ideas from people and then hands the work off to people that make me look good.
Yes.
So I want to give credit to all the people, my court staff and all of our stakeholder group.
They work
does
hard.
Phenomenal work.
They do.
That make me look good, and to the extent that I do. But they deserve all the credit for that. But and the ideas I have, I don't get. I get them from other people as I go around the state and the country talking to people about this work. But education is one of those. We know the importance of education. The school system is the only system in a community that serves every child. And I guess you may have an exception to some extent if you have a child who's homeschooled all the way through, but that's probably rare, all the way through school. But even then, they have some connection to the school system. But generally, our school system touches every child in the community. And the children spend as much or more time with the school system as they do with their own families.
Yes.
Particularly as they get older, and we're lucky to see our kids at all when they get older and have so many activities. So that's the opportunity. It's the biggest challenge, number one, because the school system has such phenomenal responsibilities. Not just to educate, but there's so much around having a child ready to educate and being able to educate the child with everything they bring from home, good and bad, if you know what I mean. So it's a phenomenal challenge for them, but it's a great opportunity as well. And so we know that there are challenges educationally. We know that our community has some issues that we could work on better educationally as a community. Again, we're sending kids to the school system, a lot of the kids with some issues or baggage, if you will, that makes it difficult for the school to teach those kids. And so we, from using some grants from the Hart family and from the Vivian Phillips Trust, brought together 23 teams, court-led teams from around the state to talk about education for a couple of days. And we had the top-level state folks down as well from Education and Department of Juvenile Justice and Department of Family and Children's Services and the Governor's Office down. And we spent 2 days talking about educational issues as they relate to the court and the community. And out of that, a lot of communities have done really well. Honestly, we've been a little slow starting. We've had other things to deal with
Yes.
over that time, and we've been sort of slow starting. I think that the trauma project has connected us with the school system better than we've been connected in a long time. They're very excited about this issue. They had a huge contingent at the town hall meeting, and they're working very hard in this area, and they're open to finding better ways to serve these children. We're starting to talk about truancy issues. We're supposed to have we do have a truancy protocol, but honestly, we haven't done the kind of work as a community that we should have done on truancy. It's not the school system's responsibility, it's the community's responsibility to do it. And we're having some conversations around that, including getting the truancy task force, protocol task force back up and running. So between the trauma, between some truancy issues we're going to deal with, and some other issues that came up at a recent meeting around disproportionate minority contact, I think we're going to have some really significant work to do with the school system, the court and the community, and supporting the school system.
Now tell me about some of those issues that you just mentioned.
Well, disproportionate minority contact
Yes.
is something a lot of people don't like to talk about. And it is what it sounds like. It started out as disproportionate minority confinement around juvenile justice. And the notion was that when you look at a community that may have a population whose minorities represent 1/3 of the general population, but kids who are placed in secure confinement represents 2/3 of the population, there's some questions need to be asked about that.
Yes.
And again, it started around confinement, but this notion has been enlarged to talk about just contact, disproportionate minority contact with the court system, with jail as adults, with child welfare, with disciplinary issues in school systems, and it's a reality. On the dependency side of the court, the child welfare side of our court, we set about a number of years ago to safely reduce the number of children in foster care. And at that time, we had over 200 children in foster care. At our peak, it was 223, I think is what it was. We reduced that number over a period of 6 years, safely reduced that number over a period of 6 years to 33. We'd normally stay from 50 to 65 at this point of children in care, and we did that safely.
Tell me what you mean by you did that safely.
It means that when we check the safety numbers, then the safety numbers, which comes from what's called NCAN data that has to be reported to the feds, actually improved in terms of being a child being maltreated again within a certain period of time. Those
Okay.
numbers improved when we reduced the number of children in foster care. Now, what that told us was, and let me say this, from a safety standpoint, it means that if you individualize your work and you deal with this family where this family is and this child where this child is, you get better outcomes, period. And that's what we were doing, and that's how we reduced the number of children in foster care. We got rid of a lot of old notions, but one thing that happened unintentionally was the disproportionality of minorities in foster care was significantly reduced by more than half. When we first started that project and we went back and looked at it in hindsight, when we had over 200 children in care, then again we have an African American community in Troup County of about 1/3, a little less than 1/3 of our general population. Right around 65% of the children in foster care were African American.
Wow.
When we reduced that number, the most recent time we checked it, I think we had 56 children in care at that point in time, and DFACS checked it for me. Then it was something like 40 to 42% of the children in foster care were African American. Now, this is a whole nother discussion and great work being done in this community around this issue of poverty. But I will say that based on what I read and see and hear, that as long as we have disproportionate representation of minorities in poverty, we're going to have disproportionate representation in a lot of other areas because of the issues around poverty. And so to actually mirror and get to where our minority population is in foster care or juvenile justice is the same as in the general population is going to be difficult as long as those populations are overrepresented in the general in poverty.
Yes.
Which is what we have. Now, our numbers are upside down in delinquency. I don't need a study to tell me that. You can come sit in on one of my court days for delinquency and you can see it. I'm seeing African American faces disproportionate to their representation in our general population. And there are issues around that, and we're going to work on those. And again, at this meeting, the school system was well represented, and we're going to work on those issues with the school system. But eventually, if we go to families and children where they are, and we serve children and families as individuals, then some of that's going to be dealt with just by doing that. Because when we come to decision making, we bring everything that we've ever experienced in our life with us. And there's a tendency, honestly, if I have a child come into my court who has had 3 siblings in my court before in delinquent cases,
Yes.
is to see that child not as an individual, but as one of those other 3 kids. And that's the kind of thing we've got to work not to do, whether we're in my court, in the child welfare system, in the school system, service providers, or anywhere else, and even just in the general community.
Yes, and also in your court, you have been, I call, proactive in the way that you deal with juveniles that come through your court. I mean, it's not just like you sentence them to the what?
Well, I can
Where they're
commit.
going.
I can commit a Department of Juvenile Justice. I can detain them.
But you also look for services that can help them, and you're very conscious of doing that. Looking at them to see if they need mental health counseling or other social services, and placing them in an environment where they can get the help that they need. Is that correct?
It's correct. We've always tried to do that.
Yes.
Search has been an issue. We have a entirely new top-to-bottom juvenile code that came into effect January 1st after 7 years of work. And it pushes juvenile justice down to the community. We can't give to the state as many kids as we used to give to the state, which is a good thing.
Yes.
But along with that came some services. We were one of the counties in Georgia that received some money for services out of the governor's office by way of a grant. We expect to get another grant this next year. And we're providing services we couldn't provide before. But also by building the service provider network around that and around trauma, we're going to find other ways to serve our families better too.
Yes, and I just want to say that we appreciate who you are, and we appreciate your staff, because I've been working with them some, and I do know that they work very hard. But we appreciate your heart for the community and your heart for the youth, and we just want to thank you for what you're doing. And also, I just want to say to you, if you are one of those people, as you listen, that you recognize that you've had trauma in your life, and maybe your children have experienced some trauma, to seek out the help that they need. And I would like to thank you for watching You Make the Difference, because you truly do.
It's a year of replevin. Got a